Hi everybody. I'm going to talk to you today about how to position a patient for ribs, particularly how to figure out the way to elongate the ribs of interest. I find that's the part that most people struggle with when they're first learning. So here we are with my Mr. Bones here and the upright bucket behind it. And I'm going to turn on the centering light, and you're going to see that I have centered to the ribs. And so the light field is including half of the sternum and half of the spine and all the way to the lateral border over here of the ribs. So in this case, we are centered over the left rib cage. So I'm including the whole left side. I'm including from the first rib way up here. Let me see, can you see that? That's the shadow up there, all the way down to, this is actually 10, the lowest part of the 10th rib. The 11 and 12 are further up in here, okay? So the entire left side of the rib cage can be seen and included. So the typical routine for ribs are a set of upper ribs and a set of lower ribs. What most people do now is they will take a 14 by 17 and try to include the entire rib cage on the left side, or whatever side is ordered, on your first exposure. And if you can see all of the ribs, including the ones below the diaphragm, then okay, you're good and you can move forward. If you cannot see the last few ribs, that would be 12, 11, 10, 9, let's say, you need to go back and recenter over the lower part of the rib cage. So I'm going to do something like this, center lower, and then of course I'm going to collimate down to just include that area. So now you can see that I've just included the lower ribs. I could actually probably go a little more and just lower my central right a little bit more than that. Okay, if you want to include from the top of the diaphragm up, excuse me, let me take that back, from the top of the iliac crest up, that would work too. But as you can see here, this is the shadow of what is going to be included on the IR. And let me fix my centering here so that we are now centered correctly. So if we were going to do this exposure, we have the center cell right here, right in the middle of that set of ribs, and it would be below the diaphragm, so you will get an appropriate exposure. Once you have those two, what we call straight shots, okay, they're both APs, you're going to need to do a set of images that include an elongated set of ribs. So how do we do that? So I'm going to go back to the full size IR, and I'm going to recenter back where we were before. So forgive me for the motion here. Okay, a little bit more like that. All right, now the way this works, and the best thing I can come up with to help remind you of which way you turn the patient to elongate the ribs, is to always move the spine away from the ribs of interest. So in this case, they are the left ribs that are of interest. And so what I want to do is turn the body so that the spine goes away from the ribs. So I'm just going to show you how I turn the body like this. So you notice the sternum's coming toward me, but the spine is moving away from me. You see how the spine is now way back there behind the sternum? Okay, so what has that done? I'm going to start that over again. I want you to watch right here on the board here. So what we're seeing is this is a straight shot. See the length of the ribs? Okay, they come around nicely here. Now, when I oblique them, watch what happens to the ribs. Just watch that shadow. Can you see how they look longer? That's what we mean by elongating the ribs. We can't physically elongate them. We're making it look like we are. So now what I've done is I've placed the patient in an LPO position. The spine is further away from the ribs of interest. Let me turn that light back on again. And the sternum, of course, is closer to us. The sternum will always be in the image. Actually, oftentimes the sternum shows up better on ribs than it does on a sternum. And that's just a great byproduct. So notice that the collimation actually reaches beyond the sternum to the upside because we always have to include the entire rib. The rib extends from the spine all the way up to the sternum. So if you go straight through the body here, the spine is way over here. So you have to make sure that your collimation is such that it's going to include the spine within your collimated border. Okay, so let's look at that again. So looking at those ribs, looking at the shadow, okay, the more I turn, the longer they get. But then if you turn too far, the other ribs are going to get in the way. So in other words, the right ribs get in the way. I'm going to turn them back again to a straight AP. And you see how narrow those ribs have gotten? I'm going to turn the spine away again. And now can you see how the ribs are more elongated? They're longer from the spine to the lateral border of the ribs. That's what it is that we're trying to do, okay? So to elongate the ribs, you're going to do spine away. So I'm going to turn this skeleton around, this guy around. Okay, so now he's in a PA position. And what I'm doing here is I'm going to say that this patient now hurts anteriorly on the right side. We always want to put the anatomy of interest closest to the IR so we get a better image. So that's what we're doing right here. And so we're placing the anatomy of interest closest to the IR, and we're going to do a singular straight PA of that side. So as you can see the shadow of the ribs all the way down from 12 all the way up to the, let me see, can you see that? That's the first rib right there. This is the clavicle, that's the first rib, okay? So we've included the entire right side of the rib cage. Once we have taken that exposure, if we do not see the ribs below the diaphragm, then you're going to recenter down lower to get those ribs on the inferior part. Then you're going to oblique the patient so that you elongate the ribs. Now that we're PA, it's a different thing. You have to think differently, kind of. The one thing that always works is you want to turn the spine away from the anatomy of interest. So if the right rib cage is the anatomy of interest, I want to turn the spine away from the anatomy of interest. So I'm going to show you the shadow here. All right. Now watch what happens to the shadow as I turn the spine away. See how the ribs are looking longer? That's how using the spine away works for you. So it doesn't matter whether the patient's AP or PA, it does not matter, as long as you turn the spine away from the patient. Now in this case, I've elongated the ribs so much that I'm actually cutting off the ribs over here. So I'm going to have to open up my collimation to include the lateral border of the ribs right here and all the way over to the spine. Can you see the light field on the spine? So I don't have to include the entire spine, but I have to include at least part of it because we have to show where the ribs articulate with the spine. Okay? So there's our picture. So in this case, we have elongated right ribs. And you might say, well, wait a minute, Colleen, you said that you wanted to have the anatomy of interest close to the IR. But in this position, it's away from the IR. Okay, yes, agreed. But it's still closer than it would have been if we turned the patient around and did it in an AP projection. Okay? And again, we must elongate the ribs. So this is what you would do. The fact that there is distance between the affected ribs and the IR is not necessarily a bad thing in this case. There will be a little bit of magnification, but the most important thing is that you can see more of the length of the rib. So that elongation is really important. Okay, I hope this helps. Good luck with reviewing this. When it comes to ribs, make sure you remember, turn the spine away from the affected side. That will elongate the ribs, and it doesn't matter which position the patient's in. If you move the spine away, you will always get the ribs elongated. Thank you.